I call them my miracle babies, not only because of the story of, us trying and kept trying, and they're finally here, but the simple fact that just a doctor taking the time to listen to my story, something as simple as getting the blood thinners and getting the treatments needed with the antithrombin. I mean, I wouldn't have been able to do it without them. I wouldn't have been able to do it without my family. I wouldn't have been able to do it without prayer.
The reason antithrombin 3 is such an important deficiency to treat is because the patient has an overall lifetime risk of 75%.
Antithrombin 3 deficiency, which is what MaKeise has, leads to increased formation of clots and decrease in what we call the fibrinolysis, which is the breaking up of clots. So she is prone to form clots.
And in my case, there were several losses. It was a total of 6 pregnancies. I have 2 kids. So if there's a pattern of miscarriages, if there's a history of clotting in your family, I would definitely suggest that you go get tested. For the most part, I wouldn't want anyone to have to go through what I went through.
She had lost quite a few pregnancies in the past, and that was the reason that we tested her to find out why she was having the losses. And when we tested in the subsequent pregnancy, we found the antithrombin 3 deficiency.
I didn't even know what it was until it was actually found. Did I have signs? Couldn't tell you. With treatment with him, we actually did blood thinners throughout the entire pregnancy, which was Lovenox. And that was about 1 to 2 doses a day. Closer towards the pregnancy, the medication was increased more, and we actually delivered a healthy baby boy. Now, on the other hand, with Christopher, the beginning of the pregnancy, we basically went through the same treatment. However, this particular time, we were able to get the antithrombin treatment.
Within the last year or so, we have identified a compound which is manufactured and can be given before the delivery to specifically help prevent the clot.
After we had some failures, Dr. Hamersley would call us in and said, no, we're going to sit down, we're going to talk about it, we're going to be proactive, I have a plan. Failure's not an option, that's her key word.
She's very proactive, and she actually went forward, went through the insurance company, and however way she did it, we were able to get the treatment, and I don't know how we could have done it without her.